Hello, my name is Dr. Shuvro Roy Choudhury and I am the Director of Interventional Therapies for a large private hospital group in India, and I also work for a little time abroad. Today I am going to talk to you about a very common problem that we all face called varicose veins. Varicose veins actually is a very common problem. 1 in 10 adults have varicose veins, but not all need treatment. People who present with symptoms are usually treated by us. Now, what are the symptoms that you might get with varicose veins? The main symptoms is that of pain and heaviness in your legs, particularly towards the evening. The legs feel heavy, achy, and they feel tired. And then in some people, you can see these big veins showing up in the legs, and they can be bendy and tortuous. Not all people with varicose vein will have the veins showing. So only 30% will have the veins showing. And if you have varicose veins which are showing, they may not cause symptoms. So just because you've got some visible varicose vein doesn't mean that you need treatment. We largely treat people who have got symptoms. So the pain, heaviness, aching I talked about. The slightly more advanced symptoms that you might get some color change in your legs. The legs may be itchy. The skin might become thick and they may become looking abnormal. And in very advanced cases, you can actually get an ulcer. The skin breaks and actually the ulcer does not heal. If you get a cut and there is an ulcer, it doesn't heal. Sometimes, because if you get an infection, it can become red. We call it cellulitis, very tender to touch, and you can get a fever. If you get a cut overlying the varicose vein, the blood might come out in a torrentially, almost like in an artery, and it can bleed quite a lot. Now, why do we have these symptoms of varicose veins? Now, if I draw you a picture, if this is the heart and this is the foot, the leg, the thing that brings the blood down to the leg is called an artery. And the tube that takes the blood back is called a vein, right? You've got two types of veins. One is the deep vein inside the muscle, and one is the superficial vein, the veins that we can see. So this is the superficial vein. So as the blood is trying to go up the superficial vein, gravity, when you're standing up or sitting, is pulling the blood down. Now this is going on, right? So heart is pushing the blood back towards the heart and the gravity is pulling it down. Now this is not good. Blood should not come down. So nature has given us some valves that stop the blood from coming down towards the foot. Now in varicose veins, due to some problem of collagen, etc., these valves are faulty, they are leaky, they are incompetent, they are not working. So instead the valve closing, the valve remains open, so the blood is coming here, it is pulling down, so it is causing increased pressure, tension in the vein here. Now what happens when you get a flood in the river? When you get a flood, the water overflows, right? The river becomes wide and the river becomes tortuous like this, right? Bendy, meandering. So that is exactly why you see these meandering tributaries of varicose veins, because you have got increased pressure of blood in these veins, right? Now, if the blood stays here for a while, what happens is that the blood cells, the red blood cells, they seep out of the vein wall and they get deposited in the skin around the vein. The red blood cells contain hemoglobin, hemoglobin contains iron, and that's why the skin becomes black and thick. Now, if the blood is here staying for a long time, the blood from the artery comes but faces pressure, resistance, right? So the oxygen carrying capacity of the blood is reduced. That's why if you have pain, and that's why if there is an ulcer, it doesn't heal, because there is not much oxygen coming into the vein. Now, how do we normally treat this? As I said, not everybody needs a treatment. Yes, for cosmetic reason, somebody does not like the look of their legs. They have got these little spider veins because the main vein has got pressure. Then to distribute the pressure, the spider veins have opened up. We can treat those cosmetically, but largely we treat veins when they are symptomatic. Now, how do we treat them? There is no medicine for it. This is a mechanical problem, so you cannot treat it with medicines. So the typical conservative treatment for this is with stockings. Stockings is basically a pair of stockings from here all the way to the groin, and you wear it during waking hours. So when your leg is down, you keep your stockings, so the blood has no chance of accumulating. When your leg is up, when you're in bed, you don't need the stockings. In fact, when you're running, you don't need stockings. This is very important. Exercise and running is good for varicose veins because the muscles are pumping and they're taking the blood back to the heart. So the stockings, sometimes if you get an ulcer, we would use a special type of stockings called 4-layer stockings. And the 4-layer stockings would help you heal the ulcer. We do it weekly till the ulcer is healed. We only go and treat the veins once the ulcer is healed. We don't want active infection when we are treating the varicose veins. Now, suppose we live in a hot country, you do not want to wear stockings, or your varicose veins are troublesome, you want to have a definitive procedure about it. What is the definitive procedure you can have? For many years, we used to do an operation. We used to operate and we used to strip or remove this bad piece of vein. Okay, so that involves cuts, that involves staying in the hospital, the risk of infection, lesser return to activity or slower return to activity, and it has a success rate of about 75 to 80%. Nowadays, what we do is we don't like cutting. I don't have a knife. We don't have cutting. So what we do is we actually go inside this vein with a little wire. As you can see on the video, we go with a little wire and we close the vein from the inside, either by heating it or maybe injecting a chemical causing thrombosis or blockage of the vein. Now, the advantage of both of these techniques is that this is a walk-in, walk-out technique, which means that literally you walk in, you walk out of the procedure, and you can climb stairs the same day, you can go about, make yourself a cup of tea on the same day. So it is a lot more minimally invasive and less disruption of your daily life. Now, within this sphere of endovenous therapy, that's a broad term, we have various modes of treating. We can treat it by heat, right? So we can put a laser fiber, as you can see on the video. We can put a radio frequency fiber. Similar, we can put a microwave fiber that is going to go and heat the vein and close the vein. Now, obviously, when you're heating the vein, you're also causing heat to the skin. That is not good because you will get redness and pain and erythema, we call it. So to protect the skin, what we do is we do something called tumescence, which is putting a layer of water and local anesthetic around the vein so that the vein gets compressed on the wire and skin is protected. Now, this tumescence obviously means putting number of injections along the line of the vein. So these laser treatment or EVLT or EVRT, if it is radio frequency, all of these are successful. I would say the success rate is about 90%. Nowadays, we have got a non-tumescent technique, and by that I mean that we put a catheter same way as before, but instead of heating, as you can see in the video, we are going to put a little glue to stick the wall of the vein and close it like that. So we put an adhesive to close the vein. The advantage, no tumescence, takes less time, no number of injections, and the great advantage is that there is less erythema and much more rapid return to work and activity. Now, when I say that we treat this very successfully, 90% success as opposed to 75% success, walk in, walk out, I don't mean to say that there is no problem. Varicose veins, treating varicose veins, there is a very small risk of DVT. The risk is 1% or so, deep vein thrombosis. The other thing that I didn't talk about is recurrence, which means, you have done a treatment of varicose veins and the veins come back, or the symptoms come back. Now, there are 3 important causes of recurrence, or rather 4. The most important causes of recurrence is, the first most important cause is that suppose you've got 10 bad veins, right? And somebody else has done the ultrasound, you're doing the treatment, you're only treating 3 veins. So the 7 veins that you did not treat are coming back. So that is not really recurrence. That is, we haven't completely treated the patient. So that is why we will like to do the ultrasound ourselves. The second cause is that we have closed the vein successfully, but the vein has now opened up because body has this natural tendency to open things that we have closed. So that chance is about 10%. That is why I say 90% success. The third cause is that there are very tiny veins that you can't see, but they have got faulty valves. There's nothing that you and I can do about it. If I can't see, I can't treat. But fortunately, that is a very rare cause of recurrence. And the last thing that I want to talk about is this concept of deep vein incompetence. What does that mean? Thus far, I've talked about superficial veins being incompetent, having not valves, right? What if the deep vein, the main vein on the inside that is going towards the heart, has got faulty valves? Or there is a blockage up here that is stopping the blood from going up. This is called deep vein incompetence. Now, you can't go and treat the deep vein by closing it because then it will stop all the blood from going up. So we can only treat that with stockings, or if we find a cause why there is a blockage up here, then we can go and treat that by putting a stent or a balloon. So in summary, today we talked about a very common problem that we all face called varicose veins, and the modern method of treating it with endovenous treatment. People with varicose vein have pain, heaviness, swelling, itching, pigmentation or blackening of the legs. They see these visual tortuous veins, and in a very late stage they can have ulcers of the leg that don't heal. Today we can treat them with this minimal invasive technique, including EVLT, EVRT or glue, and with these we can make a patient go back, or a person go back to their normal life very, very quickly. Thank you very much for listening.